I had a couple of patients recently that were here as second and third and fifth opinions. And I want to talk about that. I think they came not so much from a referral locally, but they came because they looked online. And there was one gentleman that found on YouTube about shockwave. And the reason he chose our office was because we talked about focused and not just radial shockwave. There was another doctor that was going to do just radial. That's all they had to offer. And we had focused and radial. And I do think focused works better. He had a second metatarsal head capsulitis plantar plate issue, negative on MRI, really wasn't getting better. So that's why he chose us to do this. Another patient came, they had kind of an enlarged navicular tuberosity, a child 15-year-old with his parents, and they had seen another podiatrist locally who got them orthotics. And this has happened to me before. I think the orthotic rubbed on the navicular bump and they had to send the orthotics back. And then the patients, their perception was that they kind of got ghosted by this doctor. So the doctor never followed up, orthotics never came back in, or maybe it took too long. These types of things has probably happened to me as well, where I say I'm going to do something and it takes longer. But I think communication is key. I tried to say, hey, you just go back. This happens to me as well. Modify the orthotics. And this is a kind of a positioning way that I always position this when I'm seeing second, third, and fourth opinions. Is I'm I don't expect to be much better than any of these other ones. They are very skilled doctors. I just try to think a little bit outside of the box.